Welcome back and thank you for joining us. Now on our discussion segment this morning, today we turn our attention to a topic that affects every Nigerian family: medical negligence and errors in our healthcare system. Incidents of malpractice, wrong diagnosis, surgical mistakes and delayed or inappropriate treatment have increasingly been reported across the country. From stories of patients suffering complications due to surgical oversights to delays in emergency response, the consequences are often tragic and sometimes fatal. Experts point to a combination of factors behind these errors, including overworked healthcare professionals, insufficient training, outdated equipment, and systemic gaps in hospital protocols. Now, such lapses not only jeopardize lives but also erode public trust in the medical system, leaving families vulnerable and frustrated. The issue raises urgent questions about accountability, training, and the standards of care in both public and private hospitals. To help us understand the root causes of these medical errors, their impact, and what can be done to improve patients' safety, we are joined virtually by Dr. Ozy Okhonokhua, the Program Manager of the FCT Emergency Medical Services and Ambulance System. Dr. Okhonokhua, thank you for joining us this morning. Hello, good morning, Doctor. Can you hear me?
Yes, I can hear you. Good morning.
Good morning. Thank you for joining us this morning and Happy New Year.
Yeah, we should the same.
All right, let's start with the basics. Now, when we talk about medical negligence in the Nigerian context, let's bring it home. What are the most common types of errors being reported on a daily?
Well, the most common errors that is experienced in the medical profession in Nigeria is usually misdiagnosis, where the professional responsible doesn't arrive at the right diagnosis. And sometimes we also experience issues where there are medication mistakes, where either the wrong drug or the wrong dose is prescribed, for the patient. Occasionally, we also experience poor medical advice, leading to worsening conditions. These are some of the very common errors we experience. And of course, delayed diagnosis is also another issue, in the medical profession in Nigeria. So in a nutshell, these are some of the very common errors that we experience, in the Nigerian practice.
All right, thank you for giving us that breakdown. Now let's come to real life experiences. You are a medical doctor, and I know that you are in the know concerning things that are happening towards when it comes to medical negligence. But how much of this is human error than the system itself? Because sometimes people would say, when you talk about medical negligence, let's not forget that some hospitals are overworked. The doctors don't have the right equipment to be able to carry out their duties diligently. But then you see some private hospitals that are well equipped. They have the basic medical tools that they need to give this patient medical attention. But then at the end of the day, we find out that there are certain errors when procedures are being carried out, or when prescriptions are being given out to patients. So how many of this is human error than what we're facing in the medical health sector?
The human error component of negligence is usually not as loud or as much as is reported. The only issue is that because the errors sometimes are fatal, the consequences are far-reaching. Basically, it's most of the systemic issues that are bedeviling the healthcare system eventually lands on the doorsteps of the medical professional, because he has to take, accountability. If I'm going to put a percentage, I would say, most of the errors that we experience in the medical profession that can be attributed to human errors, are less than 10%. But, these are human lives, so you cannot really understate it, because you're dealing with human lives, especially when it becomes fatal. There are some errors that are easily reversible, and such errors, are not noticed and they're not pronounced. But the ones that are more pronounced are the ones that are fatal. There's no medical professional who sets out to make errors. They are what they are. They are errors. Even for those other professionals, if you take the case of a driver, for instance, who makes an error in judgment, is his error is going to lead to the loss of so many lives. The error of the pilot, for instance, is also going to lead to the loss of so many lives. We have errors, we are human beings, and there are errors that are expected. Where there are issues is when these errors are no longer errors, but deliberate act of negligence. So we cannot rule out errors in any endeavor that a human being is involved in. And the medical profession or the healthcare profession is not an exception. The healthcare profession is a continuum from the point of diagnosis to the point of, dispensing of prescription. It's a whole gamut. The lab scientist gives you, the diagnosis. The radiologist gives you diagnosis based on investigations that have been done. The doctor has to interpret those diagnoses based on his knowledge and expertise. And at the end of the day, the pharmacist has to dispense, the medications based also on his own error or his own experience. So in this whole gamut, in this whole spectrum, errors can happen. But at the end of the day, it is the person who sits at the table as the final decision maker that is going to take, responsible and is the one taking all the heat. So there could be errors in all of this, but it boils down to the person who is taking the final decision at the end of the day. Sometimes it could be the surgeon. But the errors they are not encouraged. They are, some things that we try as much as possible, to avoid. But the challenge here is that when these errors leads to the loss of lives, it is very, very painful to everybody who is involved.
Absolutely, doctor. Now, I like the fact that you're pointing that out, that when these errors lead to loss of life, I mean, that is where the issue starts. But then you made a statement saying that no medical practitioner, would wake up in the morning, go to work and, start off their day creating these errors. Now, I want you to talk to us this morning, state some of the causes and, the systemic challenges that doctors go through and, that links to these errors that we see.
There is a challenge generally that we are aware of in the healthcare profession arising from poor funding of healthcare initiatives, globally. It's not only in Nigeria, in every part of the world. You can't fund healthcare enough, So there's this issue of, obsolete equipment in most of the hospitals. There are a few hospitals or some hospitals that are well equipped because they are properly funded. So there's issue of equipping, which is a big challenge. And then there's also an issue of infrastructure. There's also the issue. Infrastructure here could be power supply. It could be the facility itself in terms of the structure of the building itself, the way it is laid out, where you have to traverse long distances to go from where the patient is to the theater, or you cannot easily access the labor room vis-a-vis the location to the theater. Those are also prevalent. But the one that is much more alarming now is the shortage of human resource for health. There's a great gap, in the human resource elements of healthcare delivery. And we all know that a lot of Nigerians are, leaving the country in their droves. And the healthcare sector is highly impacted as a result of this. And now if you now situate this against the prevailing economic situation that Nigerians are facing, especially the healthcare provider, you understand clearly that a lot of Nigerians are going around with so much mental weight that they carry, and it affects, the healthcare delivery system. You cannot rule out the fact also that the healthcare provider is also faced with the same challenges that the average Nigerian is facing. So when you bring all this to the desktop of the tabletop of the healthcare provider, he's dealing with his own mental issues. Some of these issues could be social. He's dealing with them, but he has to solve the problem of the man sitting right in front of him. And all these things will eventually affect his own level of decision making. Now, don't also forget the fact that there's a huge number of demand, or there's a huge demand for healthcare delivery now in our healthcare institutions, because only very few are functioning effectively as they should. Situate this also with the fact that a lot of Nigerians now visit the healthcare centers, for various type of ailments. And the pressure is on the very few healthcare providers in the system. So they are overwhelmed with work. So decision-making time is sharp, is fast. They have to take decisions, as quickly as possible in order to save lives, consider the fact that they have a huge number of persons to attend to in a particular work day. So there's a lot of pressure on the healthcare provider. But I must also make this point. This does not in any way give room for, errors that will lead to the loss of lives, because having taken that vow and decision to save lives, that should be the paramount, concern. But, let's also understand, with every sense of responsibility, that these medical professionals, these healthcare providers are human beings, and they are also, in a place where, errors can happen. Our prayer and our expectation is that these errors should be, limited to, what can be easily reversed, so that lives are not lost, or even, permanent damages are not done.
So, doctor, is there a standardized checklist or protocol that every hospital must follow before, during, and after procedures? I mean, like, for example, surgeries, and if there is any at all, why are we still seeing these mistakes happening in our hospitals today?
Well, there are SOPs for every procedure, so whether it be surgical, medical, or even pharmaceutical. Even when it comes to investigations, there are SOPs, that are expected to be followed, rather. So there are standard, operating procedures for every step that you're taking. In most instances, they are properly outlined and stated, for for the professional to look at. So they are pasted, they are visible, in every, ideally.
Hello, doctor, are you there? Okay, I think I guess it's having a bit of a network issues. Hello, doctor, can you hear me? All right, then let's take a quick break. Okay, I guess it's right back. Hello, doctor, can you hear me?
Yes, I can hear you.
Please go ahead.
So yeah, I was saying that there are SOPs that's very well laid out for every professional to look at, whether before, during, and after the procedure. And these are standards, they are gold standards everywhere, that are expected to be adhered to. Where they are followed, errors are avoided. It is only in instances where those SOPs are not adhered to that you are likely going to have such challenges.
All right, doctor, in some cases of alleged negligence, I mean, families say that healthcare workers were never held accountable. What do you think prevents accountability? Is it, the lack of evidence, or is it that really these errors were being done intentionally, and, cover-ups are, tried to be done so that this case will not escalate and, bring whoever is should be held accountable at the end of the day? So why do we see these gaps each time we talk about medical negligence and holding either the doctor or whoever was on duty to attend to those patients accountable for these errors?
Every regulatory body in the healthcare profession, has disciplinary committees that deals with, issues of, negligence and stuff like that. I would make bold to say that, there are a lot of cases that have been tried, and some licenses have been revoked, for healthcare professionals. I think what we should learn to do is to, address our concerns to the right authorities. When you come and only to the social media, for instance, to lay your complaints and vent your anger, and these issues do not get to the various regulatory bodies, there will be no reprimand for anybody who is, responsible. But when every negligence and every alleged negligence is brought to the regulatory body, such complaints are sent to the disciplinary committee of the different regulatory bodies in the healthcare profession, whether it be the Medical and Dental Council, whether it be the Pharmaceutical Council of Nigeria, Medical Laboratory Science Council, Automatic and Dispensing of Regulatory Board of Nigeria. Every one of them have their own, disciplinary committee that deals with cases of negligence. So when they get this report or complaint, they address it squarely, and no regulatory body wants to have a medical professional who is not up to his responsibility in their license. So they'll be very glad to delist such persons from their license. But it is up to every person who has had an experience to table these issues before the responsible party, so that they can be adequately addressed and sanctions administered. The interesting part is that most of these issues are not brought to the public domain. If a medical professional is delicensed or delisted, you may not see it in the pages of newspaper all the time, except in some very serious cases. Most of these cases are dealt with, but they are not issues that are brought to the public, because again, investigations take a while. It's not something you just hear today and tomorrow you hear that this person has been dealt with. Proper investigation is being done, because again, you're also dealing with the professional life of that person. So you must be sure that there has been a case of negligence before the person is delisted. And this doesn't happen in a month or two. It takes a while.
Now, Doctor, educate us this morning concerning the rights of patients. Because while we're having our phone-in segment, one of our viewers sent in her WhatsApp message to narrate her ordeal when she visited the hospital to undergo a test. And she said her test result was being shown to her driver, and she felt a type of way because at that time, it was, her privacy, and it was meant for just her alone. So educate us, let our viewers know their rights when it comes to, the relationship between the patient and doctor, patient and hospital, so that we get a clearer understanding as to when issues like this happen, where we should channel our strength to and find solutions at the end of the day.
Interestingly, most Nigerians are not very aware of their rights, whether it be your right as a citizen or even your right as a patient. First and foremost, let me state that every patient is entitled to some level of privacy, whether in the area of diagnosis, in the area of investigations, or even in the area of dispensing. You are entitled to privacy. It cuts across it. From when you are consulting with a doctor, you should have some level of privacy. You determine who should be with you in the room when you are being questioned, or when you are relaying your complaints to the medical professional, or whether it be to anybody that you are dealing with in the healthcare profession, whether it be the nurse. You are entitled to some level of privacy, and you can demand for it. Yes, we know that we are not there yet where you can actually, because some setup do not provide room for privacy, but it's the right of every patient to have privacy, even at the point of consultation. Nobody should know that you have not permitted to have access to your medical history. Secondly, your medical records should also be very well protected and preserved. It is your private document. No healthcare provider can release or should release your medical history to anybody without a police or a court injunction. So if your driver gets to hear of your investigation results without your permission, it's wrong. It is only with your permission or with your approval that anybody can have access to your medical history. The same thing applies to dispensing of medications. Ideally, when your medication is being given to you, the Pharmaceutical Society of Nigeria or the Pharmaceutical Council of Nigeria has also determined that you should have a one-on-one consultation with your pharmacist. That means your drug should not be given to you across the window. Neither should your drug be given to you at reception, when everybody is aware of the kind of medication that you are being given. If I know the kind of medication that you are being given, it means I can also determine the kind of ailment that you have. So you should actually have a place where you sit down with your pharmacist and he or she explains to you step by step how you're going to take your medication. And in case there are other side effects, he or she explains to you what the side effects of your medications are. So in the whole process, your privacy is paramount. And then for your right, you have a right to know what you are being treated for. You meet a lot of patients and you ask them, what was the diagnosis? You have no idea of what the diagnosis is. And that is also an error. Demand to know what you are being treated for at every step of the way. Even if it is malaria, diagnosis is out, it has been confirmed that you have malaria. So you should even ask, doctor, what are you treating me for? What is the ailment that I'm being treated for? So that I will know what conclusion have you reached. But this happens, we don't get such because we do not pay for consultation in most times. When you pay for consultation, that is your professional interaction with a healthcare provider. If you have paid for your consultation, you should know what the result of this discussion or interaction is with your healthcare provider. Are you able to walk out of that consulting room knowing fully well that, hey, what I have this morning, I was told that I have malaria, I have typhoid, it is glaucoma, it is hepatitis, it is fibroid. You now know because you have paid and you have had an expert interaction with a professional. So for your diagnosis, you should know what your diagnosis is. Demand for it is your right. Even for your prescription, know the kind of drugs that you are being given. Gone are the days where you go to a hospital and at the end of the day they remove the name of the drug that you are being given, and nobody tells you what you're being treated, what kind of medications you are giving. Those days are gone. Now you need to know what is the drug that they are giving me, what is the diagnosis, what is the medical laboratory results saying, and then you should be having all those things at your fingertips so that you can also follow up. If you know what you are being treated for, you also will be able to know what to avoid in some instances. But when nobody tells you what is wrong with you, you probably will continue to expose yourself to the exact causative agents of what you're being treated for.
Thank you, Doctor, for highlighting those very important rights for patients. Now, let's look at some stories that has to do with surgical items being left inside of patients during surgeries. I mean, how can we define such errors? I don't know if you can, help us make it make sense for us to understand, because I'm not a medical doctor, but I know that, when it's time for surgery, it's a whole team. It's not just the doctor that is in the theater. It's a whole team, the theater nurse and what have you. So help us make sense of, how and why doctors would have such errors during surgeries, like leaving scissors, cutting boards, and other surgical items.
Okay, let me first of all put out a disclaimer that I'm not a surgeon. And I do not know what surgeons, go through. I don't know their experiences in the theater. So I really cannot speak, for surgeons as to why, a metal item like scissors will be forgotten inside, a patient. So I would not be able to speak very well, confidently, and eloquently on the issue of a surgeon forgetting or leaving any item, whether it be cotton wool, scissors, or scalpel or anything inside, another human being. So I would beg that you allow me dodge this question. I really cannot speak to it. I'm not a surgeon. I don't know. I have no answer to you for you on this matter. Pardon me.
Well understood, Doctor. Now, let's talk about solutions when we talk about medical negligence. Now, in your profession and in your own view, what do you think are the measures that can be taken to reduce medical negligence, both at institutional and also individual levels?
Okay, at the institutional levels, standard operating procedures should be very well highlighted and, stated for every step of the practice. So if every facility, whether it be public or private, states out clearly what the SOPs are for every procedure, we'll probably be able to reduce. I'm not saying it's going to be completely eliminated, because even in advanced countries, there are also errors arising from, human decisions. So we reduce, the number of errors or the gravity of the errors when we stick to standard operating procedures that are very well stipulated and adhered to. And then secondly, there's a need for continuous professional development, where regularly courses are held, refresher courses are held, such that everybody's able to be abreast of situations. This means that at every step of the way, the professional is continually renewed. I mean, his knowledge is continually renewed and enhanced, so that he doesn't lose track of what he already knows, because we're dealing with human beings who can have a tendency to forget, and then that also applies to the individuals anyway. But I'm also saying at the institutional level, government and healthcare, the Ministry of Health generally, or those involved in healthcare, that means stakeholders in the healthcare, should make concerted effort to provide for more equipment for hospital care, because the more the facilities are available, the less likely that there will be errors, because sometimes we try to juggle around to make sure that things work and they work effectively. And then again, on the path of the individuals, let us stop delaying the presentation of cases to the doctor. If you start early to treat a condition, the chances of error escalating to the point where it becomes irreversible will be reduced. When the cases are presented late, or there is delayed presentation, the risk becomes very high, and then the margin of error becomes very small. So you don't have much room to make errors when the risk becomes very high. So we should learn to present cases early, not self-manage at home until it becomes difficult and everybody's under pressure to arrive at a concise, or proper decision at the end of the day. I think if we're able to apply some of this and get more personnel engaged in the healthcare profession, because currently there's a shortage, no matter how you want to look at it, whether it's being public or private, there's a shortage of manpower to deliver healthcare services in Nigeria. So we also need to get that in place, get more, improve our human resource for health, so that we can actually deliver more quality healthcare.
All right, Doctor, before we let you go, let's see how the government can come in here, both the government and also the regulatory bodies that have been set aside to, look at these issues when it comes to medical negligence, and also the hospital to ensure accountability when these issues happen. Now, we want to see how all of this can happen without, discouraging the medical professionals from practicing at the end of the day. So what is your take on that?
It is important, like I said before, for us to realize that we're dealing with human beings. And like I did say at the beginning of my conversation, I do not think that any medical professional leaves home in the morning and says, okay, I'm going to commit so and so number of errors in the facility today. What I would say in this regard is for Nigerians to continually report cases, because if you don't test the system, you do not get the best out of the system. So Nigerians should report when they feel their rights have been infringed, whether it's in terms of negligence, and report these issues, and then it will be scaled up to the necessary bodies. There are some regulatory bodies that deal with the healthcare system. What I mean is the facility itself, because sometimes it's not just the healthcare provider alone that is going to bear this burden. The facility as a whole. For instance, the hospital has a body that regulates it, just like the healthcare provider has the regulatory body that regulates, the professional. So all of this there must be a watchdog, so that all of these two systems are being checked, so that we ensure that nobody drops the ball. Because if the facility drops the ball, it is going to be placed, the blame is going to fall on the healthcare provider. And the same way, if the healthcare provider drops the ball, the blame is going to go back to, the facility, because you cannot operate in isolation. Even if you're a medical practitioner, you're a pharmacist, you're a lab scientist, you're an optometrist, at the end of the day, you are practicing in a particular location. So if that location where you're practicing doesn't meet the minimum standard, it's going to affect your level of expertise or the quality of care you are delivering. But the bottom line is that every professional must understand that they have a duty of care. And that duty of care really doesn't give you room to shift the blame or pass the buck. The buck eventually will stop on your table, no matter how bad the situation is. There are radical approaches to delivery of care. So we are trained to also ensure that we use, every means possible to save a life. But where some things prevent us from doing this effectively, there could be some gaps. But the bottom line, like I did say, is that these are human beings, and I'm not holding brief for anybody, but I must say that there are challenges that are bedeviling the system, that place a lot of burden and responsibilities on the healthcare provider.
Okay, thank you, Dr. Ozy Okhonokhua, the Programs Manager of the FCT Emergency Medical Services and Ambulance System, for speaking to us this morning.
Thank you for having me.
You're welcome. Have a good day. All right, that is all we have for you this morning on our discussion segment. We'll take a short break now, and when we come back, we'll be reviewing the front pages of our national dailies and get to see what media did. Just stay with us.